like the guy you mentioned, I mean, when you talk about humans' needs, human desires, there's a level of their desires, right? So higher and I'll say more fundamental, basic. So this is a kind of, erectile dysfunction, erectile function is a kind of fundamental and basic function. Let's say honor and, kind of, enlightenment, those are higher, level of the, desires. So have you seen a patient like that or?
There was a patient of mine who had I took out his prostate. This is back when I used to do that, and then I put a penile implant in him, and he was a very, very successful businessman, and he was having a fundraiser for a politician, but a high level politician here in the U.S. And we were at his house, and there's Secret Service around the politician. And he goes, "Come here, Paul. I want you to meet." I'm not going to say who. And he says, "You got to see what Paul did for me." And he took his dick out. Oh. And the Secret Service comes running over. And they're gathered around him because they don't want anybody taking pictures of this big money guy with his dick out in front of this big politician.
Oh.
And this guy had one of the greatest lines ever because he was pretty old, and he says he makes love to his wife maybe once or twice a month, but he couldn't close a deal. He couldn't shake a guy's hand without the confidence of previously when he had no erections. He says he was back to making deals and real deals, stuff that made money and did nice things for people, and he was a real contributor to the society.
Well, I have to thank you so much. What I have to, really appreciate one of that is that Paul, I've become a different person. You remember how I was when I first came here? Mm-hmm. So paranoid,
quiet, paranoid,
paranoid and unhappy. I'll say I can name it that way. I had a good residency. I had a good, chiefs. My chiefs were really nice people and great people with wisdom. But I haven't seen any, I haven't done any quality of life treatment. So I was not really make them happy, my patients. But this is something I never expected I could get. As my patient become happier person, they made me happy as well. Going to the work, coming to the office was not a, dread thing. Like you mentioned, I have some friends who mentioned it, put it that way.
Yeah.
Going to his workplace is like going to like a butcher house or slaughterhouse for them. They agonize every day. They have to strive themselves every day to go there. Why? Because they're afraid of it. Patients keep saying that they are, in pain and agonize them. But for me, going to the office, sometimes I must admit that there's some patient, who have, post-operative pain or things like that. I feel, difficult as well, but still most of my patients who coming over, now it's my 50 of my practice, I have enough stack of the patients who had over, those periods, they make me so happy. Some patients send me a sweater, some patients send me a, booze, like expensive whiskeys.
Yeah.
That kind of thing really changed my life. It's blowing my mind, How can a patient my patients are all cash patients. They pay the loads of money to get the surgery. Even so, they say to me, thank you so much. You changed my life. You made my wife happy, those things, It's just it's a great joy. And what's interesting was my staffs, they are a happy person as well. Mm-hmm. They don't have to deal with, nasty, those, struggles with, arguments with the patient. They seldom do. So it really affected my life. I should thank you for that because that's what I learned from you. I didn't expect I will be the same.
So you were initially here 6 or 7 years ago?
7 years ago.
So now thousands of implants later, and you've done thousands of implants since then, you are 1,000 times happier. You learned from all of us, but it was those thousands of implants. I'm just speculating. It's gotten to the point where you like going to your office and you like seeing your patients and you're maybe one day you'll buy yourself some pointed toe boots.
So I guess you are 100 times happier than I do with your new twins. So lastly, Paul, as a master of my field, I admire what have you done, but
Thank
I
you.
just want you to ask you, how could we do better to work for our patients' happier life? How could we do better?
The thing that we really need to do is realize you're private practice. I'm private practice. We have databases that blow away academic databases. We really need to meld our work with our friends in academia more than we do. And this year I have 2 research fellows, and I hope you have
One.
Yeah. Because we need to all learn more from each other, because things have gotten so much better. I mean, I started 20 years ago doing this stuff, and what we used to do, you would just be appalled. And what we do now, I think we can still hone our craft, and what we need to do is get the private and the academics, and we got to meld our databases. And I was joking about being cocky, but we need to get everybody less hubris and more congenial, so that we can work together, get those numbers, and do better for our patients. Even though we're close, we're really close to that, to only having 2 or 3% of patients that are not thrilled.
I agree. I mean, what's interesting is that those who really have a happy patient and a happier, in my eyes, money really doesn't matter. I mean, bothers you, right? Money doesn't bother you, and doing more cases, maybe better, good thing. But you have I'll say doing a lot of cases. What I see, when that moment comes to your life, they really thinking about what I can do better for the mankind, not just myself or not just people around me. So I guess in terms of that, doing your research, what you mentioned is really important, because it will be a groundstone for the other guys who will do after us, right? And please do some more researches so that we can help.
I need to have my research fellows learn Korean. That's what I need to do. I'm so impressed with your English and everybody that works with you. But we will. You and I will. We have.
Yeah.
We put together data for papers and abstracts. We got to publish more, and we have to take our private data and plug it into the mainstream, so that we can do more for everybody.
Again, it was just so nice and great. Moment of the wisdom with you, because I learned a lot of things from you. And even though we are remote, like we have a Pacific Ocean between us,
3,000 miles, 5,000 miles away.
but still, I always think that I wanted my practice become like yours, because the way you set it up and the way how you deal with the patient, I want to be that person.
You are.
No, I'm not.
You are.
Not even close.
You are.
I just,
Believe me, you are. You have gotten there, and all of us are ridiculously proud of you, and you're gonna. I told you earlier, you're gonna have a lot of envious people, and there's a saying in Italian that the tallest blade of grass gets chopped first, but that's never gonna happen to you, because you're too happy. When you're happy, you kill them with kindness, and you're just gonna have a great career.
Thank you so much, Paul. It was a great moment again.
Coming by the office today. It's a pleasure having you all, and I hope my patients offered something. Okay? I love you, brother, very much.